Now, the biotechnology company Moderna says it'll build a factory in Africa to produce mRNA vaccines, including its COVID-19 jabs. Moderna said its goal was to produce up to 500 million doses annually in the new facility that could also include bottling and packaging capabilities. The company says it plans to invest about $500 million in the new factory. Our correspondent Lape Olarinoye has been monitoring this story, and she joins me now for more. Good to see you, Lape. How big a deal is this? Is it good news for Africa?
Well, good evening to you, Charles. Well, of course, it is a big deal for Africa, considering when the news of the vaccine arriving to the world of health that came about, the wealthier countries essentially hoovered it up, leaving almost nothing for the African countries. And we saw after that a huge donation from all over the world of what was left over after all the hoarding that was given back to those African countries. And that's what has brought the vaccine rollout in Africa to a measly 4.5%. So it is big news that, you know, there is this sort of hub that seems to be coming about, sponsored by Moderna, for the vaccines to be manufactured. But it's a little too late, really, Charles, because it's something that African countries, as well as the WHO, have been clamoring for the patents to be lifted, for African countries to be able to manufacture those vaccines. There still is a very slow rollout of vaccines across the continent. And so there is a huge room for improvement.
Well, yes, so although, I mean, in fairness, it does look like the tide has started to turn with this announcement. But as we all know, it's early days yet. Moderna is saying that it'll soon begin the process of deciding the country and location. No indication yet where that might be, but countries like South Africa, Rwanda and Senegal have been mentioned, haven't they?
Yes, they have. But you know what's really ironic, Charles? Actually, South African health officials have said that they have no knowledge of this. In fact, the director of the African Centre for Disease Control and Prevention, John Nkengasong, has also said that he has no knowledge of this announcement that Moderna has stated. So it's a question of whether this is purely lip service, or if there is a lack of transparency happening between the African countries and health bodies, as well as Moderna as well. So there is a bit of a gapping and lapse in communication there. But the fact is, it seems as though Moderna wants to have this hub in Africa. The countries have been narrowed down to, as you say, Rwanda, Senegal, and South Africa. But there isn't a proper communication channel currently happening.
I mean, presumably they're going to start doing, I suppose, more sort of research and things to decide where they're going to put it. Meanwhile, the debate still raging, Lape, between drugs manufacturers and governments about waiving intellectual rights for COVID-19 vaccines and giving more developing countries access to jabs. I mean, you touched on this briefly, but just expand on it a bit more.
Yes, Charles, sure. The thing is, when this all came about, you know, before we had the emergence of the Delta variant and the Beta variant, those were called South African and Indian variants. And of course, that was changed for prejudice reasons. And so we know that South Africa, in comparison to other African countries, was very badly hit by this. And South Africa was one of those countries, as well as India and other nations, clamoring for the patent to be removed so that the countries that are badly affected can manufacture their own vaccines and therefore curtail the spread of the virus much quicker, as opposed to waiting for donations from abroad and so on. But manufacturers like Pfizer and BioNTech were adamant against this, saying that the technology, the transfer of technology, would be too complicated to have that. Other people argue that this is to do with a financial thing and a financial gain and a sense of ownership. But again, that question comes up. What do we prioritize? Is public health still the #1 priority here if we're going to sit back and essentially watch people lose their lives because of the basic lack of access to vaccines. And that's why those countries, as well as the WHO endorsing that, asked for these patents to be lifted so that access to the vaccines and manufacturing of that could be much easier. Now, what Moderna is proposing is somewhat of a long-term solution, but there still remains that immediate short-term problem, as John Nkengasong says, that this isn't going to immediately solve the problem of a very slow vaccine rollout in Africa.
Well, absolutely. I think the bigger question, of course, is when Africa is going to start developing its own vaccines. I mean, you've got a small country like Cuba doing so much in that direction on a global scale, and Africa waiting for handouts from someone. In any case, that's a conversation for another day. Lape, thanks very much indeed. Lape Olarinoye, our ICE correspondent there, talking to me from London.